We are moving to English session. Today is our 1953rd day of continuous webinar. Thank you, Hindi team. And today's our guest is Dr. Surabhi Soni. She is MD in homeopathy. Before beginning the session, we'll have a silent prayer. Good evening and welcome everyone. Thank you all the participants for joining with us. And Dr. Surabhi Soni, okay. You're 91983. You are okay. I made you as a co-host. Okay, she is associate professor in surgery, Ahmedabad Homeopathic Medical College in Parole University, and for taking classes, I'm inviting Dr. Surabhi to our webinar. We are so glad to get you as a speaker today. Thank you so much. You're welcome. Please.
Thank you so much, ma'am, for the invitation and warm welcome. So, good evening, everyone. So today I'll be taking the topic of anxiety neurosis and the homeopathic management. So I'm sharing my PT. Okay, is it visible? Yes. Okay. So the topic is From Worry to Wellness, Exploring Anxiety Neurosis and Homeopathic Management. So now this topic is, I can say, in the typical latest terminology, it is very much trending because I have encountered taking the lectures in today's generation that I have seen many patients suffering from anxiety, and they term each and everything as I am suffering from anxiety, not knowing about which specific anxiety they have. Like, there are different terminologies which can not be considered as anxiety and which are actually anxiety, and they are unaware of it. So today we'll take a brief session on that. So from worry to wellness, exploring anxiety neurosis and homeopathic management. Okay, so what is anxiety neurosis first? It is a psychoneurotic disorder where psycho means mental or mind is involved, as well as sometimes CNS and some chemical changes and neurological, both the combination, that is psychoneurotic disorder, characterized by excessive, persistent and unrealistic anxiety. See, we also, each and every person is having anxiety. For example, if we want to perform something or we go on stage, so there is a basic anxiety which is there in each and every person. But when it becomes excessive, out of order, and it is persistent, like for example, that event is over, but still the patient is having the anxiety, that is persistent. If there is a exam phobia, exam fear, exam is over, but still there is anxiety, then it is termed as an abnormal worry. And unrealistic anxiety which is sometimes it is anticipatory. Actually there is no such problem, but there is problem in the patient's thought process. That, for example, if something bad will happen, what I will do, if I'll fail in exam, what I will do, if I'll not able to perform well on stage or anywhere he is going, or he will doubt himself, if means every time unrealistic, which is not actually present in reality, and he's constantly thinking negative of it. That is not restricted to any specific object or situation and interferes with daily functioning. Sometimes it can be imaginary and which interferes with his daily functioning. For example, there is so much anxiety that he is not able to do his daily routine, or sometimes get issue with you can say interpersonal relationship with his family member because of the anxiety, or he is not able to perform well because of this unnecessary thoughts and unrealistic anxiety. So that is daily functioning is hampered, so it becomes problem. The individual is aware that anxiety is irrational but is unable to control it. But when we take the case taking of such patient, they will also admit that I know this is not right, this is wrong. Will do counseling, they will understand, but it is not in their hand. Still they will have such kind of panic attacks, or you can say such kind of thoughts which is unable to control it. When sometimes what happened that, for example, I am also, for example, I have anxiety that today is my presentation, whether it will go good or bad. But if someone will motivate me, my senior or like that, so I'll cope up with it. I'll try to understand, okay, I'll do it, and if it is better next time, I'll be confident. But here, in spite of constantly counseling, there is no result. Again, the same situation will happen. The patient will be having this anxiety attacks. So, according to the modern classification DSM-5, which is the textbook of psychology, anxiety neurosis is no longer used as a single term, and it is included under the anxiety disorders. There are many disorders that I'll explain, that not a single is termed as anxiety. There are multiple, there are terminology. For example, uh, okay, generalized anxiety disorder, specific phobias are also considered as anxiety disorders, panic disorder, social anxiety disorder, post traumatic stress disorder, separation anxiety disorders, obsessive compulsive disorders. So these are the some of the very common anxiety disorders. So in short, if I am talking about generalized anxiety disorder, GAD, and panic disorder, which is very, very common. So, historical concept, earlier psychology and psychiatric textbook classified it as generalized anxiety and anxiety with panic attacks. Sigmund Freud first described anxiety neurosis as result from repressed emotional conflict. That is very important. Repressed emotional conflict means if you are having some issues internally, emotionally, and that is suppressed. For example, if a patient is coming and when we take history, the past history, and we come to know that there is issue in his childhood, he has a childhood trauma, that his parents was treating him bad, or they were very abusive, or they used to be violent, or there is something emotional suppression, and slowly when growing up, it developed as anxiety. So there is some repress. The meaning of the repress is suppressed emotional conflict. So, okay, so what are the causes of this anxiety? So, first is the biological, second, psychological. Psychological factors are very, very common, and in day to day practice, when we see, we can encounter psychological factors are more common as compared to some other factors. So, first is biological, where there is some logical issues, for example, genetic predisposition. I have seen a patient around 60 to 65-year-old patient. He was suffering from major depressive disorder. But what happened? He had also history of same depression. Like for example, his father was suffering from that. Then his sister, then his brother, all in the family member had this kind of depression attack in the past. Either some of them have recovered, some of them have not recovered. So some kind of attacks run in the family history. Next, neurochemical imbalance. Neurochemical imbalance means decrease of GABA and increase of norepinephrine. Now, what is that? So, it is GABA, it is a short form. The full form is gamma aminobutyric acid. So normal function of GABA is main inhibitory neurotransmitter in brain. So it acts as a brake system, calming your neural activity. It maintains emotional stability and reduces the fear response. Why we in every situation we don't get panic? We just calm our mind. We just take a deep breath and we can face that situation. It is because of the at the back of the thing, GABA is working. Like GABA is a like chemical, neurochemical, which is releasing, and it is in the normal, you can say normal value, and so that is why it is working like it is a brake system, calming neural activity, and it maintains the emotional stability and reduces the fear response. But decreased GABA in anxiety, when GABA activity is reduced, the inhibitory, the calming activity, the reduced responses is lost. And then what will be the result? Neurons become overexcitable. So the patient will be having excessive worries, restlessness, muscle tension, insomnia, irritability. These are the very common symptom of the anxiety, that the patient will constantly worry. Anything in happening with him, small or major, he will be constantly worrying. Restless, he will be constant mental and physical restless, we can see, moving from here and there, mental thoughts, shifting of the mental thoughts, cannot focus at one thing, that is restlessness. Muscle tension is that muscle spasm, there will be some muscle spasm activity. Insomnia, loss of the sleep, he will not able to get enough sleep, or for example, if he will sleep, he will be waking up in the midnight, or not proper fresh sleep. Irritability, there will be constant irritability will be present. So this is the function of the GABA, which will be reduced in the anxiety neurosis. And norepinephrine is also known as noradrenaline, NORAD in short we say. So the normal function is, it is an excitatory neurotransmitter responsible for alertness, attention, and stress response. So this norepinephrine maintains our alertness, our attention, and our stress response. That in any stressful condition also, we can just think, we can calm our mind, we can think from brain that what to do in such situation. So that is maintained because of norepinephrine. It activates the fight or flight mechanism. What is fight or flight mechanism in any stressful condition? For example, if there is a lion in front of you, so now what you will do? You know that the lion will kill you. That is very stressful condition. But in such situation, whether to stay there or whether to run, fight or flight mechanism, whether you need to fight, you cannot fight with lion, so you have to flight. But thinking, you need to be very careful that how you can escape from this situation, so that you can do with your calm mind, by managing your stress and all that. So that is fight or flight system, that how you will manage that condition. So that is done by norepinephrine. Some get very much panic in this situation, some will act very smartly. So that depends upon the norepinephrine, which differ from person to person. So increased norepinephrine in anxiety will cause overactivity of norepinephrine, which causes hyperarousal, heightened fear response, and autonomic symptoms. So the patient will get very much panic, which is out of the proportion. That level of panic that the patient will start systemic symptom, that is autonomic symptom, that is palpitation, sweating, tremors, increased bp, and panic attacks. So this will the symptoms of the systemic. Now your system is involved. So that is the function of the norepinephrine. Now again to the second slide, the causes. That was a neurochemical imbalance. The next is dysfunction of the limbic system. So dysfunction of the limbic dysfunction means impaired or abnormal functioning of the limbic system of the brain, which is responsible for the emotion, behavior, motivation, memory, and stress response. When this system does not work properly, a person has difficulty regulating the emotion, especially fear and anxiety. So again, limbic system's function is also to maintain our any abnormal function, any abnormal responses. It controls it. For example, your emotions, that sometimes in any situation, some patient will cry a lot, some will maintain the calm. So in behavior, some will be have very weird behavior, motivation, memory, stress, some will be having loss of memory in that situation. Some will not able to maintain or take that stress. So when this system does not work properly, a person has difficulty regulating emotions, especially fear and anxiety. It basically, all this thing attacks your fear and anxiety, so your response will be abnormal. So autonomic, again, nervous system will be hyperactivated. Okay, so this was the some biological factor. Now the next very important is the psychological factor, which is very commonly seen in the anxiety neurosis, that is unresolved internal conflict. As I told you in the earlier slide, that Sigmund Freud also told that it is a repressed emotional conflict. So unresolved internal conflict means what? That sometimes there is some issue for like in Ignatia or Natrum we see that there is something in the past, any major grief, any major accident, which the patient is not able to, you can say, compete with it, is not able to resolve it internally, and now that is affecting the patient. Patient is unaware of it. That patient is affected from, for example, 5 years or 10 years back, there is some situation which happened, and slowly that is causing, it is unresolved, that the patient didn't pay attention to that event. It can happen to anyone, and slowly now it is getting so much that it is creating some mental as well as physical issue. Next, maladaptive coping mechanism, very common. If nowadays you can say Gen Z's are not able to take the stress, any, for example, exam stress you will see, or any other, you can say, relationship with their parents, or any exam or career, they are not able to cope up with the stress which, for example, our parents or grandparents or that level of mature person could have taken. So I have seen many of the patient, uh, young patient coming with this issue, that maladaptive coping mechanism, they are not able to cope up with the situation, and which is leading to the anxiety symptoms. Low frustration tolerance, for example, if a patient is giving exam, any entrance exam, 2 or 3 or 4 attempts, but still he is failing, he is not able to clear that situation. So frustration, he is not able to cope up with that frustration, the failure, and so because of that, what is happening, that is sorry. Okay, so there is anxiety symptoms. Over dependency and insecurity. Over dependency and insecurity means, if for example, like Calcarea carb is very much dependent on their parents, or any guardian, or you can say any partner. So because of very much over dependency and very much security, that person, when he faces some situation, for example, if a young student, after completing 12th, he will go in hostel, so he will not able to manage that stress. Same like calcaria, he is in a shell, so he is very much over dependent on his family, or he's in very secure position, and now suddenly there is no one to take care of him, there is lack of security, that you can say protection, so anxiety symptoms develop. Learned anxiety or anxious responses, so that is conditioning, matlab, in any situation, if a person is having in general any overreaction of that particular complaint, that is anxious responses. Okay. Third is the psychoanalytical factor, repressed impulses and unresolved childhood conflict. As I told you in a earlier slide, psychoanalysis, matlab psycho, and now will analysis that repress or suppress impulses and some unresolved childhood conflicts. It can be separation anxiety, just I told you that in last, I'll just give brief about different type of anxiety. For example, one of them is separation anxiety, which is very commonly seen in the babies or children. When they see that their mother is not nearby, they become, you can see that 1 or 2 or 3 year child never leave their mother. So that is separation anxiety. When they become, when they start growing and they have to be independent, so they are not able to do that, separation anxiety, this is normal. But when the child grows bigger and bigger, for example 10 years, 8 years, and still he is not able to cope up with that separation or some of the unresolved childhood conflicts, for example if he got bullied, or he had very abusive parents, some violence, or he got bullied in the school, so there is some trauma which is there in his mind, but he is not able to resolve it. So that is one of the very common psychoanalytical conflicts. The next is anxiety arises when ego fail to control. Very common. Every person has some ego, but if any fight occur, there are ego that no, I'll not tell sorry. Or very common in the office politics, that sometimes some get promotion, some don't get, and there are some political, so there is ego clashes, and that the patient is not able to cope up. So these are the different issues with which patient will come to us. This is the real scenarios with which patient will come to us, and they will faces the anxiety. Ultimately they will be having anxiety, but the causes are different. Next is social and environmental factors, stressful life events. For example, for example, death of the close one, mother, father, or any siblings. So that is very stressful life event, and after that, the patient is not able to cope up in the life. Chronic illness. A patient is suffering from, for example, CKD or cancer, and he's taking treatment from 5 years, 10 years, and he then goes into anxiety. That again, if the relapse will happen, what I'll do. So that is chronic illness. Any family conflict that I already explained in the above topic. Occupational stress, same, the ego clashes I told you. Any occupational stress, or if there is any specific time period bound activity you have to do, and the patient is not able, because of the overburden of the work, he is not able to cope up with that stress. Poverty or insecurity, but obviously financial issue will lead to anxiety, which is very common, that if there is poverty, is not able to fulfill the monthly expenses of the home, so that is why he is facing the anxiety. Okay, so what are the clinical features? So clinical features are, first, psychological symptoms. So patient, these the earlier were different causes of the anxiety. Now the symptoms will be almost one and same. Like if there is psychological, the persistent worry and apprehension, constant patient will think of it and will be worry. And apprehension means there will be some fear that if again this will happen, what I will do. So that is apprehension, which is not occurred, but he has fear that okay, again same event will happen, again same event, again I'll fail in exam, again this will happen, so what I'll do. Fear without identifiable cause. There is no such specific threat, but still the patient is having some or other fear. For example, financial fear, or fear regarding their children careers, or anything like that, which has not actually happened, but still the patient is having that. So that is fear without identifiable cause. If there is genuine some problem and the patient is having anxiety or fear, that is okay, that is justifiable. But there is no such situation and still the patient is having fear. Irritability, poor concentration, the patient will not able to focus on his work. Restlessness, as I explained in the earlier slide. Insomnia, loss of the sleep, feeling of impending doom. Impending doom means the patient will feel very much depressive. Depersonalization or derealization, the patient will not able to realize that this is happening with him. So there is no realization, the patient is unaware that this issue is happening. Physical, what will be the somatic symptoms? So due to the autonomic activity, there will be palpitation, sweating, tremors, dry mouth, shortness of breath, chest pain, nausea, discomfort, headache, fatigue. You can see that the patient sometimes will have the symptoms of the heart attack. I have seen many patients that they will have panic attacks, anxiety, and the symptom will such same like heart attack, like chest pain, dyspnea, tremor, palpitation, nausea, and abdominal discomfort. So patient will be more in the panic situation, that what is happening. The patient is unaware that because of this situation or particular situation he is dealing with this symptom, he will think that this is heart attack or what, he will unaware of that. So that is what the anxiety neurosis, that is happening, but patient sometimes is very much unaware that it is because of this situation. You stop worrying, you stop thinking, stop overthinking, that will be gone. But the patient is constantly thinking of it, and so the symptoms will be palpitation, sweating, tremor, dry mouth, shortness of breath, chest pain, nausea and abdominal discomfort, headache, fatigue, frequent urination. Not necessarily all symptoms will be present. One or two symptom can be present, all symptom, or some 5 to 10 symptom, but these are the common symptoms. Behavioral, avoidance behavior, increased dependency on others, reduce efficiency in work, and reassurance seeking behavior. Yes, this is very important, just like pulsatilla. reassurance, that you have to constantly reassure him, no, everything will be okay. After 2 days, no, everything will be okay. Everything will be okay. You have counsel one time, two time, three time, but every time he will come, same symptoms, same worry, same restlessness, and you have to counsel or reassure, and you will reassure, the patient will temporarily feel very much better, but again then the patient will be alone, the same symptoms and cycle will start. Okay, so types of anxiety neurosis. The very first is the generalized anxiety type, chronic and persistent. Irrespective of the situation, if that particular situation has gone, but still the patient will be having, there is chronic, since 5-10 years there will be anxiety without any specific cause. For example, 5 years back, death of any loved ones. Okay, so the patient is depressed for 5 months, 6 months, 1 year, but now there is 5 to 10 years happened to that event, but still the patient is having some not feeling good and constant worrying and persistent anxiety present most days for weeks or months. Anxiety not related to any specific situation. As I told you, maybe there will be an event, if event will be 5 to 10 years back, that there has been 10 years to that event, but still the patient will be having anxiety attacks, not related to any specific situation. Next is the panic attack. So panic attack is sudden episode of intense fear. Sudden episode of intense fear means this is very common, which is very for the short duration. If that issue again and again comes, then the patient will have panic attack. Symptoms peak within minutes. Fear of death, loss of control, insanity may lead to avoidance behavior. For example, I'll tell you that if there is some stressful situation come and the patient will overthink, patient will go into the panic attack. And why it is known as panic? Panic means immediate response. Immediate means it will be within seconds, and within seconds the patient will be have very much high symptoms, and it will just like a heart attack. There will be no slowly. Sometimes we have to rush the patient to the hospital because there will be so much of the restlessness, palpitation, increased heartbeat, fear of death, loss of consciousness. So this will be intense fear of anything, that is panic attack. Okay, so these were the two types. Other types I'll tell you. Uh, Okay, generalized anxiety. So, again, generalized anxiety is a common disorder characterized by long lasting anxiety that is not focused on any one object or situation. So, that is generalized anxiety, which is not specific to one or another event, but it is constant. Those with generalized anxiety disorder experience non specific persistent fear and worry and become overly concerned with everyday matter and everyday issues. Everyday activity, the patient, for example, if he has to go from one place to another, he will get anxiety. In daily activity also there will be constant anxiety. That is what generalized anxiety disorder. A generalized anxiety disorder is characterized by chronic excessive worry accompanied by three or more than following symptoms like restlessness, fatigue, concentration problem, irritability, muscle tension, and sleep disturbance, which I already explained. Generalized anxiety disorder is most common anxiety disorder to affect the older adults. Yes. GAD is common in the older people as compared to the young generation. As I told you, in young generation there are panic attacks, there are separation anxiety, there are some phobias. But in adult 60 plus, 70 plus, there will be a constant anxiety. Anxiety can be a symptom of medical or substance use disorders, and medical professional must be aware of this or okay. Now next is specific phobias. Specific phobias is the largest category of the anxiety disorder. In that, specific phobias which include cases in which fear and anxiety are triggered by a specific stimulus. This is very common. For example, I'll tell you a patient is having phobia of flight, particularly of the flight. So whenever the patient will travel in the flight, the patient will be having a phobia. So the symptom of the phobia will be same: restlessness, palpitation, perspiration, and all that, not able to concentrate, will be having panic attacks. Or the patient is having a phobia of water, any animal, phobia of anything, but that is specific, which is very common. Every person has some or other phobias. Some is claustrophobia, the patient is very much claustrophobia, means in a closed room, phobia of the closed room. So according to the National Institute of Mental Health, phobia is an intense fear of or aversion to specific object or situation. Individuals with phobias typically anticipate terrifying consequence from encountering the object of their fear, which can be anything from animal to location or bodily fluid. For particular, for example, a patient is having as I told you, flying, blood, water, phobias of highway driving, tunnels, so which is very specific. So again, the symptoms will be trembling, shortness of breath, palpitation, and perspiration. The next is the panic disorder, which I already explained. Next is the social anxiety disorder. Social anxiety disorder, which is also again very common, that the patient is not able to face the society or any event. For example, also known as social phobia, described as intense fear or avoidance of negative public scrutiny, public embarrassment, humiliation, social interaction. Patient is very much embarrassed or fear of appearing in the public places or meeting with the society or public or any performance or like that. He becomes very much fearful. So that is social phobia, which is very common, you can see. Next, post-traumatic stress disorder. Post-traumatic stress disorder means PTSD, which we say. As I told you, that any event happened in the past, death of some close one or any illness, and after that, the patient is not able to cope up. That is post-traumatic disorder. Any major accident, any loss of the loved one, any like cancer or any disease or anything. That was an event which happened. It took 5 to 6 months to overcome. Any person, depending upon person to person, it takes five. Some takes days, some takes months, some takes weeks to overcome that. But if it is constant, it's 5 years, 10 years, 12 years, 20 years, but the patient is not able to cope up, that is known as post-traumatic stress disorder, which is very common in, I guess, after delivery, sometime loss of the child, after a cesarean section, if the mother is having delivery and the loss of the child, or after pregnancy. PTSD is very, very common. Separation anxiety disorder. Again, separation anxiety disorder is a feeling of excessive, inappropriate levels of anxiety over being separated from a person or place. Some people in old age, you can see that separation anxiety of a place. If a person is living at a particular city since childhood and suddenly he has to move from that place, so that is separation anxiety. Separation can be from a place or can be from a person. For example, as I gave you example that a student after 12th standard going to hostel, so leaving their parents, leaving their siblings, leaving their friends, separation anxiety disorder. Some of the parents having shifting job, like those who are working in bank have shifting job from one place to another, so their child gets a separation anxiety from their friends. They have to constantly move from one place, they have to settle at different place, so they have a separation anxiety disorder. Other is OCD, obsessive compulsive disorder, which is very common, that a particular person has a OCD of constant hand washing, infection, checking the door. So this kind of anxiety is constant there, because which is not normal. So the patient is constantly doing that activity and checking that, that is OCD, obsessive compulsive disorder. Okay, so these were the common anxiety. Now we'll move towards the homeopathic management. So I have taken the therapeutics for the anxiety neurosis. The very first remedy is the aconite, we all know, in the acute condition. I have divided into the key anxiety picture, modalities, and associate physical symptoms, which are the important and keynotes. So sudden onset of acute fear, panic, often after a fright, shock, or traumatic event. So you can take it in the PTSD, post-traumatic stress disorder, that, or even in panic attacks, the acute fear. Suddenly some thing happened and the patient got panic, or after any traumatic event, the patient got panic. Intense restless, fear of death, and anticipatory anxiety. Anticipatory anxiety means again and again the patient have a feeling that in future the same will happen what I will do. So that is anticipatory, which is not happened, but just thinking of it making the patient very much anxious. I feel I'm going to die. This is anticipatory anxiety. The patient is well, doing well, there is no problem, but he's thinking that if I die, I'm going to die. If he'll have a very minimal issue, then also he will think that if I will die, this is some cancer, this is some major chronic disease or what. So these are the thoughts which will patient be suffering from. With rapid shallow breathing, there will be then same like panic attack, shallow breathing and rapid breathing. Worse at night and after midnight. Dryness, fear dominate the picture. A very important keynote of the aconite is the dryness and fear along with the symptoms. The modalities are aggravation at night, cold and fright, and better by fresh air. So these are the extra symptoms which we can take in the totality if we'll get these modalities. And associated symptoms is palpitation, thirst for cold water, agitation, inability to rest. Agitation means constantly moving or shaking. That is agitation. And patient is not able to rest or sleep. He is constant restless. Second is urgentum nitricum. So, sorry. So, urgentum nitricum again. We have seen in the aconite that the patient is having fear of death, but urgentum nitricum is kind of performance anxiety, anxiety with anticipation, worry before event. Very specific. If you will see any young age teenage or any office patient, office or corporate job patient who is worry before event, who has constant worry that how it will how the event will occur, will I able to perform or not, will my exam will be good or not, in this event will I be able to present on the stage or not. So that is anxiety with anticipation, worry before event. Argentum has very specific fear of height and open spaces. uh, Argentum has one of the delusion that every corner of the building is growing. So that is abnormal delusion which is not actually there, but there is thought that the corner of the building is growing. And he has the fear of flight, which I told sorry height, which I told you in the phobia, specific phobias, that the patient is having phobia of height. So you can take it in the specific phobia, or you can prescribe it in the specific phobia. And even in the open spaces, patient become impatient, restless, mental confusion, hurried thinking. He will not able to, as I shown you in the second or third slide, there will be the neurochemical imbalance, the GABA, decrease of GABA, increase of the NORID. So all that, what that was the calming, they were giving the calming effect to our brain. They were giving uh, they were releasing in the body so that our mind can be calm and we can think, we can focus in a stressful condition. But here there will be hurried thinking because of the causes I have showed you in the earlier slide. Often digestive complaint with diarrhea before event, very common. I have seen many patients suffering from diarrhea because in anxiety the patient will have some GI disturbance because of the anxiety, and the patient will suffer from diarrhea. So often digestive complaint with diarrhea before the events. So in urgentum, you have to remember that anxiety with anticipation, worry before events, and anticipatory, or you can say anxiety diarrhea before any event. Typical modalities: aggravation, anticipation, before exam, speech, better company and reassurance. But once the patient will start performing, the patient will perform really well. Associated physical symptom is bloating, belching, cramps, and frequent urgent stool. Third is arsenic. Again, arsenic with restlessness, Anxiety with restlessness and insecurity. Same like aconite. Fear of being alone, fear of illness. Perfection is driven by fear of inadequacy, anxiety about health and death. I need reassurance and I am afraid of the dark. Same like aconite, but aconite has very much acute condition and turmoil. But in arsenic, there is restless with insecurity. He has specific that this is the disease and what will happen if I will die. This is the disease need to check it, otherwise I'll die. Fear of being alone. There is some kind of insecurity in there. Anxiety about health and death and needs reassurance. Modality, aggravation, night after midnight, cold, better, warm drink, small sips, SQSI, small quantity in small interval, thirst. Associate physical complaint symptoms are burning pain, weakness, fatigue, and frequent urination. These are the, along with that, these are the complementary or you can say other physical symptoms. Yes, again, Jalsemium, very important anxiety remedy. Same like Urgentum, the patient will be having performance anxiety, apprehension before the events, and patient will also be having diarrhea before the events. But this patient will not have any delusion, and along with that, there will be tremors, fear, paralysis, attacks, anxiety with weakness, tremblings, apprehension before event, exams, performance, mental dullness, inability to concentrate, feeling of heaviness, drooping eyelids. These are the additional symptoms will not be present in the Urgentum. So, which is the differentiating point of the Urgentum and Gelsemium. Gelsemium will be having very much drowsiness, dizziness, tremors, which will not be present in the Urgentum. Urgentum will be having more of the delusions. Here there will be trembling, tremors. Anxiety, along with anxiety, there will be the tremors of the hand or shaking of the body, mental dullness, inability to concentrate, aggravation before important events and better by rest, head heaviness, vision blurriness, and trembling limbs. Ignatia, again, Ignatia, you can take it in the post traumatic stress disorder or chronic illness or any event, anxiety following emotional trauma, grief, loss, or disappointment. See, here it is used the word emotional trauma, grief. Emotional trauma, it is not just a simple trauma, it is very major trauma which happened in the past. For example, loss of any loved one, major financial loss, or any event like that. Grief and sadness. There is difference between grief and sadness. Sadness is a simple feeling of dull mood. For example, I can be sad now because what I have thought not happened, or any small thing happen in life we become sad. But grief is what, which is specific, very major. For example, loss of the loved ones, major financial loss, any major trauma, any major accident, and you have lost any body part. So very much you can say it is more in the severity. So that is grief. So ignatia patient will be having grief, rapid mood swings, silent suffering, sensation of lump in the throat. Yes, that is known as globus hystericus. From the word only you can understand hystericus means it is hysteria which is not actually present. This is very common. Lump in the throat means the patient will feel that there is something in the throat. There is like a lump. There is something stuck in the throat. So that is a sensation that there is lump in the throat which is not actually present. So that is known as globus hystericus. Weeping and sighing. Weeping is crying and sighing means taking a long deep breath. Okay. So aggravation alone at quiet moments, better by distraction and company. The patient will need company. Associated insomnia, nervous, stomach, spasmodic symptoms. Kali Foss, I have done one STSH program in which anxiety, neurosis, and the Kali group of remedies I have taken. That it was a retrospective analytical study where I have taken all the Kali group and I have seen the result and I have made a final conclusion that how Kali group act in the anxiety, neurosis. So one of the remedy that is Kali Foss. So anxiety from mental overwork, exhaustion, or burnout. As I told you in a cause that when a patient is not able to take frustration or corporate job or occupational issue, so you can prescribe in that when there is over mental burden. For example, a student is having over mental burden of studies, exhaustion, burnout. So in that you can prescribe Califos. So anxiety from mental overwork, exhaustion, burnout, irritability, forgetfulness, fatigue, sensitivity to external stimuli. So these are the very common. Even in Kali group, you will see in the group study there is core anxiety in the center, and they are very family oriented people. So along with that, there will be irritability, forgetfulness. The patient, because of that anxiety and stress, the patient will forget little things, where he has kept this thing or what he has told something to some person. So he will forget a day-to-day activity or anything. Fatigue and sensitive to external stimuli. Modalities: aggravation, mental exertion, very common in Califos and better by rest and quiet. Next, debility and trembling. Next is lycopodium. Again, lycopodium is same as you can say even in the silicia you can see a performance anxiety in the we have seen in gelsemium argentum, but it is a bit lighter than gelsemium and argentum. Argentum and gelsemium has other major symptom, but in lycopodium there is specific performance anxiety, anxiety due to lack of confidence and low self-esteem. He don't have any other issue, but he only have lack of confidence, and because of that whenever the patient is appearing in public or speaking something or giving a speech, he will have a lack of confidence. But once the patient will start performing, he will perform really well. So anxiety due to lack of confidence, low self esteem, fear of speaking in public, worry about what other will think. See, this we have not seen in the earlier remedies, but here lycopodium is very self-conscious. The lycopodiums are basically, you can say, the higher authority people or any, you can say, CEO or like that, who are very manipulative. And they also worry about, or they are image conscious, that if this will happen, what other people will think. So when you take totality or you take a case taking, you can bring out such symptoms. The patient will say all this thing in flow and flow. Start task close slowly, better with familiarity. Yes, the patient will perform with anxiety, but once the patient will start performing, he will perform really well. Modality: worse, late afternoon before task, better after eating. And digestive complaints and bloating and gas. Even lycopodium you can compare with the silicia. Natrum mur, again you can compare it with the ignatia. Natrum mur also have same, but he has typical relationship trauma, or some you can say young adult you can see anxiety with emotional suppression, deep sadness under calm appearance, sensitive to criticism, hates to be contradicted, dwells on the past hurt. Yes, dwells on the very common in the natrum mur. We all know that natrum is irritable person, but he will be have constantly brooding about the past event. For example, he will not be very much traumatic, but he will constantly once in a while will take out that point that this thing happened to me, this thing happened to me, this thing happened to me. So he will 5 year back, 10 year back, that thing happened, and he will constantly be dwelling on it. Sensitive to criticism, he will not able to take criticism, he hates contradiction. Anxiety with emotional suppression, you will see when you read natromure, it is very common in the young adult, in the anemic, having a vertigo, specific vertigos, hammering, headaches, migraines, anemia, all that which is typical natromure patient, but also having relationship issues. So because of that, the patient is not able to cope up. Aggravation, heat, social tension, better by quiet support. Associated physical symptoms will be headache, craving salt and water retention. Yes, very common is craving salt. Natromure, you can see the craving of the salt, and headache. Very typical headache of the natromure. With anxiety, there will be headache, and typically hammering kind of headache. Phosphorus, key anxiety picture, anxiety with fear of impending catastrophe, means tragedy or disaster. He will be having anxiety that something tragic or disaster happen. For example, if he is investing in something or in share market, he will be having anxiety. What will my uh, money will lost? What I will be cheated? So that is impending catastrophe, tragedy or disaster. Fear of tragedy or disaster. Highly sensitive, easily startled, desire for company, but also exhaustion, fear of being alone in dark. So you can also take a synthetic remedy, for example, natrum phos, magphos, or different, where the patient is very much sensitive, but also artistic and fun loving at the same time. Easily startled, he always want desire company, but also get exhausted from that company, and fear of being alone in dark. Modalities: aggravation at night when alone, better by reassurance and companionship. Yes, this is very common in the anxiety patient, that anxiety patient constantly needs reassurance. So if you will give same like pulsatilla that I'll be taking in the last remedy, that constantly you will reassuring it, the patient will feel better. Companionship, the patient wants someone to be near him, so he will feel better. Tingling, weakness, bleeding easily in some cases. Yes, it is one of the hemorrhagic remedy. So you will see hemorrhagic symptoms in that. And yes, pulsatilla. Again, pulsatilla female is very common. Anxiety with emotional sensitivity, weepiness, fear of rejection and loneliness. Here the pulsatilla female is very mild, gentle, weeping tendency, and always want some or other kind of support. She will not able to face rejection. She will be having a fear of rejection and also loneliness. Pulsatilla patient always wants someone near her. Needs comfort and reassurance. Reassurance is very common in pulsatilla as compared to other remedy which we have seen earlier. Ambivalence means state of having mixed or conflict feeling and mood changes. In pulsatilla, even the mental as well as physical symptom, changeability of the symptom you can see. Mood changes, or in the physical symptoms you can see shifting kind of symptoms you can see. So yes, this was the pulsatilla, the modalities, aggravation evening in warm room, uh, alone, better by open air, sympathy, and associated complaint is digestive upset, headache, and menstrual complaint. In pulsatilla, you can see the menstrual complaint very, very common, headache as well as digestive upset. Okay, so these were the 10 common therapeutics I have taken. It is not, you can say, direct you can also prescribe a,
Right?
yeah, I joined again. Over, it was some, there was some, that is it.
Anyway, it's finished, right? You finished the topic, right?
It's finished.
Okay, thank you so much. You explained everything very
Yeah, I have finished. That was the live.
I think there
Thank
is
you,
some
ma'am.
network issue. You explained everything very clearly. It
Yes,
was a wonderful
there is some
session.
network issue.
Yeah, it's a wonderful session regarding anxiety disorders. Uh, Thank you so much. I think Dr. Ram Parvesha sir want to ask something to you. Sir, you can talk.
Thank
Give
you,
me two
Dr.
more minutes.
Anjani, and congratulations, Dr. Surabhi Soni. on your wonderful
Thank you,
presentation.
sir.
Anxiety neurosis. Anxiety neurosis is a very good describe the lot of medicine
Yes,
and key picture of medicine. And anxiety before fear, 50% patient fear after anxiety. And fear is the main role of anxiety. Anxiety, there are many kinds of familiar anxiety and over depends in family anxiety. Yes, calcarea car medicine, security and protection
yes,
in father, and natural new remedy,
yes,
security and protection in mother, and lycopodium remedy, security and protection sister and brother. है ना? So a kinds of anxiety, a kinds of fear, है ना? So very thanks, Dr. SURABHI SONI. Very nice.
Thank you so much,
Congratulations.
sir.
Thank you very much.
Thank you so much,
thank you,
sir.
thank you, sir. Thank you, sir.
Dr. Surabhi Soni, very informative class. You are looking so young, but your class is so mature class. Very nice.
Yeah.
Thank you. And this is the end of today's English session. Come again, okay? Come again with another class.
Sure.
Ah.
And thank you all the participants.
Whole team IFPH. Whole team IFPH.
Yes.
Very thanks. Again, presentation. And very nice. Congratulations.
Yeah.
Thank you.
On behalf of IFPH, I'm Dr. Ram Parvesh Shastri.
On behalf of IFPH.
Okay, now bye-bye, good night.
IFPH.
See you the same time. I'm handing over the session to Dr. P. Shailini. Malayalam
Happy
session.
New Year. Thank you. Happy New Year. Whole team.
Okay, Dr. Shaila. Dr. Shaila, I'll make you so. I'm so sorry. I was